Imagine being able to have more direct access to your doctor, longer visit times, and more personalized care at an affordable rate. That's the goal of Coronado Health Direct Primary Care. Dr. Harpreet Tsui joins me now, and let's talk a little bit about your background.
Yeah. Thank you first for having me. So I've been an internist in the Valley for 14 years, and I realized a few years ago that we have more primary care doctors than we do actual patients, right? So people need a primary care doctor. And when I went to open my practice, it was really important to me that patients have time. So I opened a practice with a small panel of patients where patients have access to me via text, via email, via phone calls, whenever they need me. And it gives them that personalized care that they deserve and allows them to have the time that they need with their doctor. And we've been able to grow a great practice, and I love being able to serve the Valley.
I like that a lot. And one of the areas that you really focus in is women's health. What are some of the other focuses that you have?
So my bread and butter is primary care. I love primary care. So everything that you can think of when you need to go see a doctor, from chronic conditions like diabetes, heart disease, asthma, COPD, to when you're feeling sick. I also do a lot in the weight loss space. There is a lot of science out there for treating excess weight, and obviously women's health, which is one of my personal loves.
And you know, May is Mental Health Awareness Month, and I think when it comes to women and women health, and you have menopause, premenopause, all of this kind of stuff, PCOS, it does, I think, eventually affect our mental health down the line. Let's talk about some of the correlation between the two.
Yeah, so what's really interesting is women's health has never really been studied. And so the average visits to the doctor a woman makes to get a diagnosis is 5. So you go to the doctor and you say, I have these symptoms, I have these hormone issues, I'm having these issues with my cycle, XYZ is happening, and doctors are saying, it's fine, this is normal. And it's not normal, it's not fine. And part of the reason that I love doing women's health is because our health affects our mental state. And if we're being told that our symptoms are not real, that gives us increased anxiety. It can give us depression and all of those things, and make us really feel overwhelmed, right? Like, I have these symptoms and I'm being told it's normal. And when you come to me, I will sit down with you and I will say, yeah, these are real symptoms. Let's figure it out. Especially in like the PCOS, perimenopausal, menopausal space, when you have symptoms affecting every part of your body, you really need a doctor who's going to sit down and be like, yes, I believe you. Yes, you're totally right. Let's figure out a way to fix this.
And that's where having a primary care doctor really comes into play. So let's remind everyone the importance of visiting a primary care doctor.
So many people think they only need to see a primary care doctor when they're sick, or they have a cold, or they have an accident. It's so important after the age of 18, when you age out of your pediatrician, that you establish with the primary care doctor. You see us at least once a year. We make sure you get all your screening tests done. We'll make sure you get your blood work done. I say that the most important thing a primary care doctor can do is be preventative, right? We want to give you quality of life. We don't want to just give you quantity of life. So the healthier we can keep you, the better it is for you, and the better it is for our whole community.
And the best way for our viewers to get in contact with you, coronadohealthdpc.com for more information. Dr. Harpreet Tsui with Coronado Health Direct Primary Care, thank you so much for coming in and hanging out.
Thank you so much for having me.